Let's get back more to the action steps. I think we've done a great job of kind of illuminating how does this happen. But first step, when somebody comes in and you see thyroid, you see gut issues, you mentioned DNA stool test. Are you going to run blood immediately, or is that more of like a downstream effect so you don't worry about it up front?
You mean blood for the thyroid?
Yes. Like, are you going to do thyroid panel at the same time as a stool, or are you going to just focus on the gut?
Only if I see overt thyroid symptoms, if there's any family history, because a lot of times thyroid can overlap with adrenals. So I always look at the adrenals first before thyroid, unless we see a lot of hair loss, a lot of cold hands, a lot of cold feet stuff, a lot of weak fingernails. If we see a lot of low thyroid symptoms, then I'm going to take a look at it. Now, most people, they've already done some digging around their thyroid before they come see me. So usually there's some labs that have already been run that I can look at. And if not, then if we have those issues, then we're either going to, one, just go after the adrenals month one if we don't have any overt symptoms and see how we do. And then if we're not having improvements out of the gates in regards to temperature, energy, those kind of things, then we do it. If we see that temperature and energy is a big deal out of the gates and we know cold hands, cold feet, hair loss, we can quantify that maybe with some basal temperature testing and we know it, then we'll probably just rule out that low thyroid out of the gates just to make sure. So it just kind of depends where patients are coming in from. And of course, if it's family history, that's we're going to really dive into that. And because autoimmunity affects women 5 times more than men, if it's a female patient, I'm a lot more on point with it. And if we have history of it, sister, aunt, uncle, mom, dad, whatever, then we're going to be looking even more closely. But if I'm on the fence, usually I'll just have patients do some basal temperature testing with a really good digital thermometer. And we use the protocol in the members area, which is, testing armpit, axillary area, 97.8 to 98.2 in the morning or 98.2, 98.6 for the mouth. And we'll just kind of test that. We'll do three temperatures test in the morning before you get up and move around. And we'll just kind of get a window of how good that temperature is or not.
So if you're on that low end, did you say 97.8? Was that your low end?
So yeah, axillary 97.8 to 98.2. That's armpit, axillary, same thing.
So if you're at
98.2, 98.6 for the mouth, oral.
Okay, so if you're at that very low end, is that still okay, or you start to get concerned in that 97.8 level?
It would depend. It would depend where the patient is. If they have thyroid symptoms, I start to get more concerned when they're going below 97. Also,
because I'm always in 97. Like I'm 97.8 all the time, and I'm thinking, well, crap, why am I not 98? But
that isn't that big of a deal. I'm getting a little more concerned when I'm below 97. But with women, you got to be careful because women's temperature can dip right before ovulation and then peak as going through ovulation. So if you grab that temperature right before ovulation, it could look a little bit artificially low. But also if you grab it right in and after ovulation, it could be artificially high. So as a female, the best time of the cycle to test is probably that first 5 or 6 days.
Yeah. Okay. That's good information.